We have a lot of research projects in our center and also in my research team. So I'd like to talk about what is the role of our Center for Global Safe Water, Sanitation and Hygiene. And the center was started about 12 years ago, and it was really through the vision of Gene Gangarosa. So he saw that here in Atlanta, there are a lot of people working on water sanitation and hygiene. People at CDC, people at the Carter Center, people at Georgia Tech, people at CARE, the NGO CARE that's based in Atlanta. And he started pulling together meetings that would bring these groups together to talk about the work that we're doing. So we have three main goals in our center. One goal is to do applied research to provide the evidence for decision-making about water, sanitation, and hygiene. What works and what doesn't work to solve these problems that we see, and trying to really bring evidence so that there can be rational decisions about what type of water interventions, what type of sanitation interventions, how can you maximize the impact on health. A second goal of our center is that we work on monitoring and evaluation, again trying to understand what works and doesn't work. And a lot of times we are working closely with implementers or practitioners in the water, sanitation and hygiene arena, trying to monitor their programs, evaluate their programs, and give them the feedback to know whether what they're doing is working or should they adjust, adapt, so that they can be more effective with their programs. The third main area of activity and third goal is to build capacity, and that's training the workforce, the WASH workforce of the future here with our students, and also building capacity with partners in different parts of the world where we work. So a lot of times we work with an NGO in some of our research. So building the capacity of that NGO to be able to collect data and interpret that data and use it to make their programs more effective. One of the most exciting research projects is looking at water and sanitation in slums. And slums are complex and interesting environments. And because I'm drawn to problem solving, there's a lot of problems that need to be solved in slums. And we've been looking at how do children in slums get exposed to fecal contamination through lack of sanitation. So how does lack of sanitation lead to fecal contamination in the environment, fecal contamination of water, fecal contamination of food? And so that's one of our main research projects. It's called the SaniPath Study, and it's funded by the Gates Foundation. Another project that we have is looking at water, sanitation, and hygiene in healthcare facilities in low-income countries. And you would think that if you go to a hospital or a health center in a low-income country, that that would be the one place where you would have clean water and toilets and good hand washing and hygiene. But sadly, that's not the case. And there's been very little data research in this area to date. And our group is one of the first groups that spent time on the ground collecting data, measuring water quality in hospitals and health centers, looking at hand washing facilities, looking at hand washing behavior, looking at whether there are toilets, looking at how hazardous infectious waste is handled in these healthcare facilities. This work is funded by the GE Foundation, and it's really helped spearhead an initiative with the World Health Organization and UNICEF. The other area of research that we work on is noroviruses. And I don't know if you've heard about noroviruses. They are also called sometimes cruise ship viruses, or sometimes it's called the stomach flu. But these are incredible pathogens, and I've been studying these bugs for a long time, I guess about 25, 30 years almost. And they are amazing. They're the most infectious agents that have ever been described. So that is part of the key to their success. And we've looked at how infectious they are, how long they can survive in water, how long they can survive on surfaces, what does it take to disinfect them. who gets sick, trying to describe the epidemiology of these viruses in children, in the elderly, also in travelers. So we have a study now of travelers' diarrhea, where we're trying to look at the burden of norovirus among travelers. So this is our other big area of work.